Chronic pain affects millions of older adults, creating a daily struggle with arthritis, back pain, and stiffness. But groundbreaking research from Harvard Medical School shows that yoga offers scientifically validated relief. Here's what the evidence tells us about how this ancient practice is transforming pain management for seniors. The pain problem. Chronic pain affects about 50% of older adults, with osteoarthritis, lower back pain, and joint stiffness being especially common. Traditional pain management often relies on medications, which carry risks of side effects, dependency, and drug interactions. A study published in Annals of Internal Medicine, involving 313 people with chronic low back pain, found that weekly yoga classes increased mobility more than standard medical care. Can yoga work alongside traditional care while reducing medication dependence? Harvard research and the science. Harvard Medical School researchers have conducted extensive studies on yoga's effects on pain. In one landmark study funded by the National Institutes of Health, researchers enrolled 90 adults in a year-long trial comparing Iyengar yoga therapy with standard medical care. The yoga group experienced a 29% reduction in functional disability, a 42% reduction in pain, and a 46% reduction in depressive symptoms after 24 weeks. 6 months after the trial ended, 68% of participants were still practicing yoga regularly. In another study published in the journal Spine, people with back pain who did 2 90-minute sessions weekly for 24 weeks experienced a 56% reduction in pain, along with less disability and depression. What's happening in the body and brain? First, gentle stretching and strengthening exercises improve flexibility, build supporting muscles around joints, and enhance range of motion. Second, neuroscience research using brain imaging revealed structural changes in yoga practitioners. Studies using magnetic resonance imaging found that experienced practitioners had more gray matter in the insula, a brain area vital for pain processing. Yoga practitioners tolerated pain more than twice as long as controls, and gray matter volume positively correlated with years of practice, suggesting yoga changes brain structure to improve pain tolerance. Third, yoga activates the parasympathetic nervous system, which counters chronic stress that amplifies pain perception. Specific benefits for seniors. For arthritis sufferers, gentle yoga poses help maintain joint mobility without high impact. A study among older adults with osteoarthritis found that chair yoga exercises for 45 minutes twice weekly for 8 weeks led to less pain and fatigue. A follow-up study found that adults with knee osteoarthritis were better able to carry out daily activities after a 12-week chair yoga program. For those with rheumatoid arthritis, women reported improvements in physical health, walking ability, pain levels, energy, and mood after 2-hour-long yoga classes weekly for 8 weeks. Beyond physical pain, yoga addresses the psychological component. Harvard Medical School experts note that pain specialists are urging doctors to prescribe yoga for lower back pain. Chronic pain often comes with depression and anxiety. Yoga's mindfulness and breathing components reduce anxiety and improve mood, breaking this cycle. Research on seniors practicing daily yoga found they fell asleep 10 minutes faster, got an extra hour of sleep, and felt more rested upon waking. What makes yoga safe and effective? You might be thinking, I'm not flexible enough for yoga. The yoga studied by Harvard isn't about contorting into pretzel shapes. Dr. Lauren Elson, medical editor of the Harvard Special Health Report, An Introduction to Yoga, explains that yoga helps strengthen and stretch back muscles that might be tight, improving mobility. Senior-focused yoga, including chair yoga and gentle yoga, is specifically adapted for older bodies. Poses can be modified using props like blocks, straps, and chairs. Chair yoga is performed while seated or standing while holding onto a chair for support. The emphasis is on moving mindfully within your own range of motion. Harvard researchers emphasize that regular, moderate practice works best. Even 10 to 20 minutes a few times a week can provide benefits. The key is consistency and working with qualified instructors who understand senior needs. Harvard Medical School recommends seniors consult their healthcare provider before starting yoga, especially if they have severe osteoporosis, uncontrolled blood pressure, or recent surgeries. Getting started. How can seniors get started safely? First, look for classes labeled gentle yoga, chair yoga, or yoga for arthritis. Many community centers and yoga studios offer these. Second, inform your instructor about any pain issues or limitations before class. A qualified instructor will provide modifications. Third, start slowly. Even 10 to 15 minutes can be beneficial. Gradually increase duration as your body adapts. Fourth, focus on breathing. Harvard research highlights that breathing techniques are therapeutic on their own, reducing stress and helping manage pain perception. Finally, be patient and consistent. Benefits accumulate over time with regular practice. The research is clear. Yoga offers real, measurable benefits for pain management in seniors. Harvard Medical School has demonstrated through rigorous studies that this practice can reduce pain, improve function, enhance mood, reduce medication dependence, and even change brain structure to better handle pain. It's not a miracle cure, but it is a powerful, evidence-based tool that addresses pain from multiple angles: physical, neurological, and emotional. For many older adults, yoga has meant the difference between being limited by pain and enjoying an active life. If you're dealing with chronic pain, consider giving yoga a try. Thank you for watching. If you found this helpful, please like and subscribe. Take care and be well.